Live streaming from the WMBB newsroom in downtown Panama City. This is 13 Now.
Hi, everybody, and welcome to a special edition of 13 Now. I'm News 13's Amy Hoyt. We're coming to you live from our newsroom in downtown Panama City. It's good to have you with us today. You may know that the month of November is Men's Health Awareness Month. And one of the cancers that's most common is prostate cancer. And sometimes men don't even know that they have it. So we want to share some information with you today, and so that you can learn about it, and women can talk to their husbands and wives and all that. You can have that conversation. Joining us today is someone you will recognize. He is the president and CEO of Innovations Credit Union, David Southall. Thanks for joining us today.
Hi, Amy. Thank you. Glad to be here.
And the reason you're here is because you are a prostate cancer survivor, and you were diagnosed last year?
Last year, February of 2022. That's right.
How did you find that diagnosis? Was it just a routine checkup?
Yes, actually, it was my PSA numbers started to rise. And in most men, they have a PSA number they should get screened for. It's a blood test. And as men get older, that PSA number typically rises. And in my case, the number started rising. A few years ago, it was around 1.5 to 2. The next year, it was 3. The next year, it was 4. So the urologist that I see said, we need to check this. This number is getting too high. So the higher the number, the higher the risk of prostate cancer.
Now, was it a routine checkup, or did you have any symptoms?
Actually, I had no symptoms. It was just the PSA number. And that's the thing about prostate cancer. It's so common in men. About 1 in 7 in their lifetime will have prostate cancer. And a lot of men don't know they have it. And without screening or having your doctor check, a lot of men go undetected until it's really too late. So the earlier you get checked, the better.
Of course, the PSA is a blood test.
It is. It's a simple blood test, so it's easy to do, and most men should do it every year with their annual physical.
Right, and the one thing we don't want to talk about, but we have to, it's like women with mammograms, is the digital rectal exam, because sometimes that comes with a routine exam too. And
it does.
And we talked earlier about pilots go through that. They get that almost every year because they sit so much.
Right. And then as men age, about 50 years old, they start doing that. And that's one of the reasons some men go undetected, is that they don't want to do that type of exam. And we have to do it as we get older. And like I said, most men, the older they get, the more likely or the higher risk they are of prostate cancer. Even young men can have prostate cancer. So the blood test and the digital rectal exam are things that you should be doing. Now,
did you have a family history of prostate?
I did not.
No.
And that was one of the things that I was asked, did anyone in your family? And I said, not that I was aware of. And a lot of times men, as they get older, if you live long enough, you're probably going to get it at some point. So, and it's very slow growing. So some men may get it when they're older, and then they really never get checked and they don't know they've had it.
Now, as they're telling you your numbers have gone up and you need to look a little further, like, is prostate cancer coming into your mind? I might be a cancer patient.
It is. We discussed that. The rising PSA number could mean several things. Some men have enlarged prostates, which that can cause the PSA number to rise. If you work out or ride bikes or do anything like that that irritates the prostate, that number could go up as well. So when you do a prostate screen or PSA screen, you need to make sure that you're not exercising, you're not riding bikes right before, or any kind of sexual stimulation. All of those things make that PSA number rise.
Okay, so when you're formally diagnosed, how did you feel?
Oh, wow. Well, anytime you hear the word cancer, it's very frightening, and a lot of people handle it different ways. When I talked to my doctor about it, well, what happened is my PSA number had risen, and the doctor said, let's do a biopsy. That's really the next step. So we did the biopsy, and he said, your PSA number isn't terribly high, but it's high enough to where I think we should check this. So they did the biopsy, and the prostate is really two sides. The urethra goes through the prostate. So when they do the biopsy, they take 6 cores from one side and 6 cores from the other, and different quadrants of the prostate. And in my case, when they did the biopsy, it came back with one of the 12 cores as having a cancerous lesion. So It was pretty frightening, and you just have to do what you need to do and get treatment.
Now tell me about these pictures. Was that that we were just looking at? You were in the hospital. Is that what's going on here?
Oh,
there you
yeah,
were
I
happy.
think that was the,
Where you were
probably
going,
the biopsy.
where you weren't sure you were happy.
Yeah. And the biopsy was, it wasn't painful at all. It was, it's done. You're not under any anesthesia. So it's pretty quick and painless. And some of those pictures are probably after the procedure I had done, and I can talk about that. So, yeah, it's not pleasant, but if your PSA numbers are high or you have any symptoms, it's something, the prostate biopsy is something that you really, really should do.
How long between the biopsy and the surgery?
I got the biopsy in February, and that's when I was diagnosed, February of 2022. And when I was diagnosed, my local urologist encouraged me to look around and find the best facility that I was comfortable with to go through some sort of treatment. And I reached out to the Moffitt Cancer Center in Tampa, and so that's where I went. And they wanted to do a second biopsy to better define the area. Like I said, there's different quadrants. So the quadrant that my cancer was in, they did a more specific biopsy in that area only. And unfortunately, after that biopsy, I got an infection, and it's very uncommon. It's probably 3% of men that have these biopsies get an infection. That was sepsis. So I was in the hospital for over a week. That wasn't very pleasant, but that biopsy was necessary to determine exactly where that cancerous lesion was. And they also did an MRI to better define that as well. So the Moffitt Cancer Center folks were terrific, did that. And then I did a procedure in October to do, it was called irreversible electroporation, IRE. And we can talk about the different types of treatment options there are. And that's a treatment option that I chose.
And so there's no surgery. They don't remove the prostate.
No, that is one of the options.
Okay.
You can do a full radical prostatectomy where they remove the prostate. In my case, I had one lesion, so they did what's called a focal therapy. I could have done the prostatectomy, or I could have done radiation treatments. There's several options, but mine is kind of a new technique, and I wanted to share that. So if any other men out there that are faced with prostate cancer now or maybe in the future, there are a lot of options. In the past, the prostatectomy was mainly the treatment plan that was used, but now with the advance in medical technology, this irreversible electroporation was a focal therapy where it went in the perineal region with probably 4 or 5 pins, and they go right into the prostate, and they surround the cancerous lesion, and they turn the electricity on. So they're zapping it. Instead of freezing it or burning it or radiating it, they use electricity. So it kills the cancerous cell, and it protects the cells around it. So it's very specific, and it took about 2 hours. Of course, I was under anesthesia.
Oh, good. I was going to ask. Hopefully.
I was. So it was about a 2-hour procedure, and it takes a specialist to do this type of procedure. So that's what I did. That was my choice.
Were there any side effects coming out of that?
Anytime that you have a procedure with the prostate, sometimes it takes a while to get your urinary tract back in order and things working normal again. For me, I had to wear a catheter for a little over a week, and that was absolutely the worst part of it. Yeah. The procedure itself wasn't bad, but having to wear the catheter was not pleasant. So I stayed in Tampa. We had a place near the hospital, and once they removed the catheter, it took a couple weeks, maybe a month, to kind of get everything back in order. And so there were no side effects after that. And today it's all very normal, and I'm back to pretty much new.
So you're clear, or do you have to wait a little bit longer?
What you do, my procedure was in October of 22. So every 3 months I would get my PSA screening. Okay. And let me tell you this, right before my procedure, my PSA was at 7, which is very high. That was in October. In December, I checked my PSA for the very first time, and it was 1.5. So the doctors were very happy. That's what they were looking for. They wanted to see that PSA number back down. So in December, I did the PSA check. Then you do it for every 3 months. So the 3 months later, it was still 1.5 1.6, still low. And then at the 6-month mark, we did an MRI. So they wanted to take a look at it through that technology. And the MRI showed that there wasn't anything there, but they really want to do biopsies to really determine that it's gone. So they did that at the year mark, which was just last month. So when they did that biopsy, it was clear. There were no cancerous lesions anywhere in the biopsies, the 12 cores that they took. So now going forward, I will continue to monitor my PSA, but no further biopsies are required unless my PSA number starts to rise again. So that's what I'll always check that.
What are the odds of that happening again?
They didn't really give me the odds, but they just said that, anytime, it could come back. And if it does, my PSA number certainly will increase and we'll be able to check it by doing another biopsy. And if it does come back, I'll certainly repeat the procedure that I had done, the irreversible electroporation, because it was easy is not the right word. It was very effective, and I didn't have the whole prostate removed. If you remove the prostate, there are a lot of side effects that you can have, from urinary to EDs and other things. And I was hoping I didn't have to do that type of treatment plan or that procedure, and I didn't. So I was very fortunate.
Now, when we talk to breast cancer patients, we always talk about the importance of family support. You got to have somebody to help you through this. And you had that. Oh,
I did. My husband, Greg, he was with me the whole time, and other family members and friends. We had text strings going out every time there was an update. So, and I've got a lot of friends and family. It's hard to keep everyone. I didn't want to put it on social media just because it was very personal, but at the same time, I wanted as many people to know, because it's an important topic. And all of my male friends, since this happened, I've really been on them to, make sure you check your PSA. And it's funny, I'll get friends or family members text me, "Hey, I just got my PSA and it's 0 point something." Like, oh my gosh, that's very low, very low.
You're
Good
having
for you.
it.
So yeah, I let people know that it's something they really should check too.
So you're using it for the good. You're having a positive impact.
Oh my gosh, yes.
On others. And we saw the picture with you at the airplane. So you're also a pilot.
I am.
You got a lot going on in your life.
It is. I'm very busy, and I have a lot of hobbies and activities. So this kind of thing, I didn't want it to keep me down, and it certainly didn't. So it's such an important thing for men to check. It's prostate cancer, like I said, is one of the most common cancers in men, and some men are more at risk than others. Right. For instance, older men are at higher risk. Even African American men are at higher risk. Young men are at risk. Any male is at risk, basically. So really, people need to get their PSA checked and monitored as often as they can.
Now, do you have any male siblings? Because now it's a family history thing.
I do. I have an older brother, and when I first was diagnosed, I asked him if he had ever had any problems, and he had not, and his PSA number was very, very low. So it didn't run in my family, which was, like I said, unusual, but it doesn't mean if it's not in your family, you're not going to get it.
All right. What else am I not asking? Any advice you have for others?
Just don't be afraid of the doctors and how they do the checks. The blood test is easy, but the rectal exam, not everybody likes that, but I think it's one of the necessary things that as men get older, they need to do. And even younger men, I've got friends that are in their 30s and 40s, to go ahead and start checking at least your PSA numbers. And the doctors, when you do your annual blood test, they can do that. And don't be afraid. It's for your own good, and it'll save lives.
Right. We'd rather you live.
Absolutely.
Than to wait until it's too late.
Absolutely.
All right. Well, David Southall, we appreciate you sharing your story. I know you're touching a lot of lives today.
Thank you.
And you volunteered, so we appreciate that.
I did. I reached out to you. I said, Amy, I want to share this story. I saw Katie Petronas last year and my friend Ray Cotton this year share their stories. And I just think if you know somebody in the community, I think it helps to get your face out there and tell your story. Because like I said, if my story can help save some lives, then I feel good about that. And hopefully men will go get checked now. Maybe they haven't before, and catch it early like I did. And if you catch it early, the survival rate is very, very, very high.
That's right.
Yeah.
Early detection is key.
It is. It really is.
All right. Thanks so much, David
No,
Southall.
thank you. I appreciate
Prostate
it.
cancer survivor. We appreciate you so much. So don't forget, gentlemen, wives, you might have to remind your husbands or your brothers or your uncles, anybody in your family that is a male, that they should have their prostate checked because, again, like David had said, the symptoms are almost silent at the very beginning and you want to catch it quickly. Thank you for watching today. We'll see you next time.
Thank you for watching 13 Now. For more information on this live stream, visit mypanhandle.com. Stay updated with all of the Panhandle's news, weather, sports, and more by downloading our 13 Now news app, available on all smart devices.